Dr. Sharyce Baartman, and I am going to talk today about different types of hearing devices that we dispense here at the Hearing and Speech Center. So we have behind the ear devices and in their ear devices, and they're going to be used for different types of hearing loss and different patients depending on what their needs are. So anytime we deal with something that goes behind the ear, this is a power hearing aid actually that has an ear mold. This is going to be used for people that have like draining ears, like let's say maybe they have ear infections or have had lots of problems with their ears where we can't actually put something in the ear that's going to be anything used for electronics like microphones or speakers. We don't want that in the ear because otherwise it will plug up and it will actually damage the hearing device and decrease the life expectancy. In addition, we may do this for someone who has a very significant hearing loss, like a profound or severe hearing loss where we're concerned with feedback. Because if we keep everything behind the ear, we can get more gain or power from the hearing device. So when this is in someone's ear, the mold in, that is what it looks like for someone who has a power hearing device. Another behind the ear device this is called a RIC, but it has a power speaker on it or a custom embedded mold. So the speaker is still in the ear, which tends to make things a little bit clearer. And when you have a device that goes behind the ear, the microphones are separated a little bit more. So you will have better acoustics where it's going to be able to filter out some of the background noise a little bit. So we do like behind the ear devices typically for a lot of patients. If it's embedded or the speaker's embedded inside of a mold, we can also get more power that way and less likely with feedback. So that's going to be based, same thing, on if someone has a healthy ear or a larger ear canal, or if they need more power or gain because they have a more significant hearing loss. When I put this in, it looks a little bit better than the mold because you can hide it a little bit better in the ear canal. The last behind the ear device that I'm going to show you is called a RIC. It's called a receiver in the canal. Same thing, the microphones are able to be separated a little bit more. It has more components on the inside of the hearing device, so you can use a rechargeable battery. The microphones are separated a little bit more. You can put more computer chips inside of it, so you may have better access to speech reduction or noise reduction features inside the hearing device. This also, we can use a dome on the end, so it leaves your ear feeling a little bit more open. As soon as we plug the ear with something, you feel kind of like your voice is inside your head. So when we have a device like this, same thing, it looks good. It has a lot of features inside of it. And when I put it in, my ear feels open. I can barely tell that it's in there. So that's what that looks like. And then some people want just in the ear devices. They don't want to deal with anything that goes behind the ear. They may have had surgery on their ear, or they may have issues with comfort behind the ear. The other thing I've seen is that people maybe have dexterity issues where it's hard for them to get things behind their ear and then also in their ear. So they might deal with something that just goes in the ear. We call this an in the ear hearing aid. It takes up the entire spot of the ear, but it's very easy to insert. So same thing, depending on the hearing loss, we may not want to use this style because it does make your head or your voice feel like you're talking in your head, kind of like a barrel sound. So if someone has normal hearing in the low frequencies, it's hard to fit something like this because you will have a barrel effect with your voice. Some people get used to it within a couple of weeks. So depending on the hearing loss or the needs of the patients, we may decide differently on what style or type of hearing device. I do have some people that are missing fingers, and so it's hard for them to handle a device, but this is very easy to get in. So we may look at something like this for that reason. You can go down in size a little bit. So this would be called the half shell. So it doesn't take up nearly as much space, but it still does plug your ear a little bit. The other disadvantage of the smaller you go, the less separation you have between the microphones. So if you have a full shell, you get a bigger separation between the microphones, which gives you speech and noise reduction features inside the device. So it can analyze your environment a little bit better. When you go to a half shell, then you don't have as much separation between the microphones. And sometimes we can only use one microphone. So then the computer chip has to work harder to try and separate your speech and your noise when you're in difficult environments like wedding receptions or restaurants. The other thing is if you have something like this, a lot of times you can get rechargeable batteries in it. If you go to a smaller device, some people want something that's really small that goes in their ear. Now you're dealing with just one microphone. And then you also have to use typically a zinc air battery. So then you have to change the battery every 3 to 4 days on average with something that is like this. So it's small, it goes in the ear. Most people can't see it unless they look from the side. There's a removal string. Sometimes people think this is an antenna, but it's actually how you can take it in and out of your ear easily. And then this is a new device from Oticon. It is a small device that goes in the ear, very similar to the CIC or completely in the canal device that I just showed you, but it is rechargeable, and not sure how they did it, but they're able to also have compatibility with your phone. So it has Bluetooth in it. So if I put this in the ear, it does have a removal string, but that actually is the antenna for the Bluetooth also. So to take it out, you have to use that to take it out. The other feature is that it uses a dome, so it doesn't feel quite as plugged up as the other devices that go in the ear. So when I look at something like this, you have to deal with the size and shape of the ear canal. And the other thing is I'm limited with how much power or gain I can give someone. So it's not appropriate for all hearing losses because you'll get more feedback or squeaking. And anytime I work with a patient, I do not want them to have feedback or squeaking. So if someone gives them a hug, I don't want their significant other or their loved one or their grandchild to have noise coming out of the hearing device in their ear. So those are the different options that we currently have with hearing technology. Thanks so much for listening.